Hello world and everyone else watching this right now. We're currently at the United Nations General Assembly in New York, and we're talking to different young people that are here getting to hear the work that they're doing. You're with me, Takale Itai, one of the members of the Adolescent and Youth Constituency for PMNCH, that's the Partnership of Maternal, Newborn and Child Health. So we're outside sitting on the lawn getting to hear from other young people and amazing youth leaders and to hear the work that they're doing. So here with me we have Carlos from Youth Act for Abortion. Carlos, please do tell us about yourself and where you're from and the work that you're doing.
So my name is Carlos. I'm a 6th-year medical student from Spain, and I'm also part of the AY constituency and working as part of the International Federation of Medical Students Associations, which is a medical students federation that represents 1.3 million medical students worldwide in 127 countries.
You said 1.3 million students?
Yes.
That's incredible.
So basically, we have a permanent committee on sexual and reproductive health, including HIV, and one of the main focuses that we work right now on is on providing future healthcare providers with the information and the capacity building necessary to understand why access to safe abortion is so important for everyone. So online on what you were mentioning, we have this initiative called Youth Act for Safe Abortion, which is a set of capacity building 3-day workshops in which we try to clarify the values and transform the attitudes that medical students have towards abortion. Our reality is that we are multicultural, we have a lot of diversity within ourselves, so it's really difficult for us to convince everyone to be abortion or future abortion providers. But what we really want to do is create an impact into medical students and make them aware why women accessing safe abortion is such an important thing, and why do we need to reduce the number of unsafe abortions happening. So we have this public health based and human rights based approach in which in the workshop we provide them with the information, we can provide them with the data. Okay, so we have 50,000 women dying every year because of complications related to unsafe abortion. We have every year 22 million unsafe abortions happening, and this needs to stop. We need to be able to provide the services that women need and are entitled to, so this stops happening and we tackle this major cause of maternal morbidity and mortality.
Does the data help actually really convince people to actually take action and come on board and support?
The data helps because it quantifies the problem and makes provides them with I don't know how to say the context of why it is important. But I found through the delivery of the workshop that what works better is the different testimonials that we provide and the different perspective of women that required an abortion or that had to undergo an unsafe abortion because of X reasons, and that's what gets to the people in a more deeper way, the emotional connection with someone else, not data only, but seeing the people behind these situations. So for instance, we have an exercise which is called the New Perspective on Abortion, in which we set up a gallery of different sentences by women that they required abortion, from different contexts. And there's this one that always impacts people a lot. It's when it's basically a woman saying, when I had to get an abortion, I didn't see it as killing my baby or as a scene, but rather as getting the chance for me to actually get getting the chance from God to actually get the baby when it was ready to have it. And that one I think is the one that impacts the most people.
So most of the time, most of the challenges you face is because of the religious aspect.
I would say that of course that plays a huge role. But I cannot quantify that, but definitely depending on the setting in which you deliver the workshop, that is the big aspect. In certain regions, it's more about the social stigma associated to it, and like the barriers and the restricting like legal frameworks that don't allow like providers to like actually provide those services. But what we always like manage to get is like have this like shift of like of perspective, and people end up like, we have like data like people's assessment, and 87% of the people actually change their attitudes towards abortion, like identifying it as a key issue to be covered and something that future and current healthcare providers should be like aware of and more sensitized towards. So yeah, like we are not like training like people to deliver abortion, but we're training them to so they understand why is it important, and so they can refer like those women or like people that require an abortion to someone who will actually deliver it for them. I guess that's like kind of like a summary.
Wow, it's good to hear what you're doing, and we'll be following more and the achievements that you're actually executing.
Actually, in the past 4 years, we've trained over 300 medical students through these like capacity building efforts, and we have follow-up like actions. Like so, like when we train them, we actually like kind of follow up on what they will do in their home countries.
Yeah.
So we recently this year had an activity like in India, another one in Kenya, Ghana, Poland as well, Ecuador, and Colombia, among other like smaller.